So what is your name?
My name is Brigadier General Humphrey Kisa Kenya. I'm retired. I worked in the Army for many years. I had a privilege to train in the US. I also worked with the United Nations in Iran as a peacemaker. I also had an opportunity to work in Somalia to reconcile the warring parties until peace was achieved. Now I'm retired. On the 29th of April 2020, I was driving from Kitale along this road, and I got involved in an accident. There was a tractor which hit my vehicle. And the first place that I was attended to after the accident was Jawapu Medical Facility. Little did I know that 2 years later, God was doing something, preparing us that I was going to be one of the directors of this medical facility with a view to giving back to the community. I have seen many people suffer, and having been had an opportunity to interact with a lot of agencies and also people, I felt that we should be able to do something for humanity's sake. And I see this as a step that we'll be able to spring from to establish more hospitals within this community. And that will be my joy.
Amen. So what is your name?
My name is Dr. John Kiberenge Wanambisi.
And what is your role here?
I'm a doctor and a technical person in this project that we are running.
And what is this project? What's the vision?
In Kenya, we have gaps. Healthcare has a lot of gaps. People to access hospital, it takes a long time. That's why we decided to start a hospital in this rural place so that we can reach the people in the villages and prevent people from walking long distances to seek for healthcare.
Okay. And what phases of development do you see it rolling out?
We've divided this project into three phases. The initial phase is the renovations of the place. Then the next phase will be to start the outpatient department. Then the final phase will be run the inpatient.
Yeah.
That will be the third phase.
And what kind of patients for inpatient? You talked about maternity.
Okay, maternity. Actually, as we start off the outpatient phase, we also intend to start operating the maternity, because mothers walk long distances, like as far as even 50 kilometers away to seek help, to just have even a normal delivery. So as we start off the outpatient, we also want to make sure that the maternity is also up and running.
And what kind of vehicles do you need?
We need ambulance. Yeah, and basically, as we start off, ambulance will be of essence. We can get an ambulance, that will be fine.
And what kind of staff do you need?
Staff for a hospital, there are so many personnel, various professions that will be needed. We need doctors, nurses, pharmacists, driver. Then we also need an accountant for the hospital administrator, housekeepers, the cooks, those will cook for patients.
Okay.
We need security guards. We also need ICT experts to run the hospital management system.
Okay.
And even nutritionists to advise people about their nutritional needs.
And what kind of healthcare tools do you need? What kind of equipment?
Equipment, it will depend with the department. Let's say for the laboratory, you need like full hemogram machine. You need a microscope. We need biochemistry machine. We need We also need like glucometers to check for sugar. Then for the outpatient and triage area, we need patient monitors, blood pressure machines. We need SpO2 machines. Yes, then for ambulance also has need some machines, of course, to be equipped into it, like oxygen, the ECG machines, and so on. Then other machines that we need are computers, yeah, to run each and every department.
Okay.
Need several computers. On the lowest side, according to our assessment, need about 15 computers. Then we also need photocopying machines. We need scanners, printers. Yes.
Okay. And final concluding remarks.
Then maybe just to add on those ones, again, other machines, like for inpatient, we of course need beds, hospital beds, those special ones. And final remark, we appeal for any help, anyone who is willing to stand and support this project so that we can help save lives in the rural villages of this country. Thank you.
And, okay. So what is your name?
My name is Delphine Wafula.
And what is your job here?
My job here is the accountant and the secretary, taking minutes of all the board meetings happening here. Yeah.
And what vision do you see for this hospital?
I envision as helping the community most, the underprivileged, the needy, and just to ensure we have a healthy community around here. Yes.
Amen. And how long do you think it'll take for construction?
Construction schedule, we're projecting a year.
Okay.
A year, let's say 10 months.
Okay.
10 months to be precise. So far, most renovations have been done. We're just looking at the maternity wing, the private wings also, and the more wards because we're targeting a bigger community. Yeah.
Okay. Perfect. Thank you.
Thank you.
Okay, so what's your name?
Edward Hawaya.
And what's your role and what is this project?
So I am the founding director of Mubmo Modern Hospital. This is a hospital that is constructed in one of the remote areas, about 30 minutes drive to the nearest medical hospital. And many accidents really happen here, and women, when they are pregnant and they want to give birth, they cannot reach the nearest medical hospital. So we decided to begin a chain of Mubmo Modern Hospitals in most remote areas where people cannot easily access medication in good time.
Amen.